on to our fourth and final speaker in this webinar now, Naeem Younis. Welcome, Naeem. He's the CEO and founder of Strassys. Naeem's been at the forefront of coaching and developing leaders and boards through using data to make better decisions. He's going to discuss with us the AI Magpie Effect, how to use AI alongside human experience and scientific rigor to help health boards make well-informed strategic decisions and by challenging them to think differently. So welcome, Naeem, over to you.
Thank you, David. So we heard from James how we can use data differently to make decisions and make an impact at scale. We've heard from Chen in terms of the dangers of blindly adopting AI and applying critical thinking, the importance of applying critical thinking. And we heard from Gareth in terms of how we need to use data in a more meaningful way to make impact to the patients. What I'm going to try to do is try to bring it all together and try to answer the question of where does AI fit in all this? I mean, the reality is AI is no longer the future. It's here and it's everywhere. And like with any transformative technology, debates emerge. On one side, the optimists are saying, you know, it's going to improve diagnosis, deliver personalized care, make care more accessible. On the flip side, we've got concerns about widening inequalities and losing that human touch. But the real measure of success is how it creates value for patients and communities. Going back to the point James was making very earlier on in terms of we can make all the decisions, but unless they're making a difference in the lives of people, it's not very useful. But however, decisions on how healthcare resources are used rest in the hands of very few people. For example, within the NHS, the provider boards typically manage up to £3 billion of spend, and we've got integrated care systems which control about up to £5 billion. So if we want thriving communities and deliver at scale, we must help these leaders make the better decisions, grounded in data, focused on delivering value. My argument's pretty simple. We can achieve far more with the data and the technology we already have. And by focusing on this, focusing on the basics, we can start laying the foundation to really optimize the value from AI. Just reflecting my experience over the years, I've had the privilege of working with leaders like James and David, who've shown courage, humility, curiosity to embrace new ideas and asking the right questions, the tough questions. But more importantly, seeing things through. It's the action. And that's what the real challenge is. And going back to what Chen was saying, there's brilliant, analyses. But what do you do with this? How do you take it forward? That's the real kind of sticky point. And human nature is complex. Decision-making is messy. So we have to really focus on the outcomes and the value we're trying to really deliver. And that's what really matters. So back to the webinar question. And given the time constraint, I can talk a lot, but I'm going to contain myself. And I'm going to share with you 4 nuggets or 4 takeaways based upon our experience of working with systems here in the UK and internationally in terms of how we can use data, stroke AI to make better decisions in the boardrooms. Next slide, please. So as actually James was alluding to earlier on, if you stood back and typically observed a board discussion in a, let's say, NHS organization, the usual topics of discussion are conversations around workforce, finance, quality, compliance, but actually they're all in silos or in sequence. And then there's an attempt being made in terms of connecting the dots by using integrated performance reports and dashboards. So what you have is an ocean of data, and too often decision-making becomes subjective because there's so much going on, and the loudest voice often wins, and what all leads to busyness without clear value. Based upon our analysis and experience of working with many organizations, one of the unintended consequences, if you imagine £1 being spent on an organization and the service it provides, of that £1, typically 50p gets spent on non-patient activities, and that's a lot. So to make better decisions, going back to what David was saying earlier on, we need to help leaders think differently and systematically. For example, connecting decisions between what does cost reduction mean in terms of staff morale, what does it mean in terms of productivity, what does it mean in terms of impact and quality, what does it mean in terms of patient outcomes. It's the connections that makes a difference. And through this systematic analysis, we are already seeing huge opportunities for improvement. For example, one organization we work with using this approach, there was a 10p shift away from the bureaucracy to spending more time, effort, and resources on patient care, unlocking better outcomes and efficiencies. So that's one nugget. Next slide, please. But with all this sea of data available to us, question I always ask is, what are the analysts within these organizations focusing on? What are the analyses they're doing? And often they're spending majority of the time generating reports, creating operational dashboards, focusing on regulatory compliance and reporting. And a lot of the analysis are transactional, what I call transaction in terms of activities, waiting times, spend, patient flows, workforce metrics on vacancy, and so on. And of course, in the future, AI will be able to assist with this to make it a little bit more automated and less burdensome. But the real opportunity is shifting the focus of the analyses from the transactions to the human stories, the consumers. What value are we delivering to our staff, to our patients? It's the human stories behind the numbers. And what we find is whenever you do this, when you ever translate complex data to meaningful stories with people behind it, magic happens. Light bulb moments go on and people can start gathering their thoughts around what decisions need to be made and how to use those limited resources to make the biggest impact. So the question really analysts should be asking is, who are we doing all this for? Who are the people, who are the patients, and do we really understand their needs, behaviors, motivations, and unmet needs? And again, as I mentioned, when boards shift their thinking, decision-making from the lens of the people they serve, innovation happens. Just give another example for a complex multi-billion-pound system. When we did this piece of work where we took the leadership on this process of looking at the world differently, all of a sudden, leaders started begin to think differently, look beyond the services, look beyond the buildings, and agreed new ways of working. And we identified millions of pounds of savings. Now, same resources were focusing on the transactional stuff, giving them what I call the 1%, 2%. But by thinking differently, they can focus on the 20, 30%. It's a huge shift. And from our analysis, if we do this in this particular way, the trapped value in the NHS is around about 6 to 10 billion pounds. So it's a huge opportunity. So that's my second nugget. The next slide, please. Now, one thing I've learned, I'm a self-confessed data geek and I love technology, is even with the greatest insights, decisions require judgment, tough choices, and trade-offs. And this is even more important in the world of AI. And it's going back to Chen, what you get is a black box, right? When you get the outputs, you have to make a judgment call in terms of what is that decision we're going to make, what's the trade-off we're going to make. Now, if you look on the illustration on the right-hand side, this is an actual health system we work with. And the exam question we were trying to answer there was, how do we improve care for children and young people? And we did some amazing analyses. But what these boxes are representing are the decision points. Different organizations, different groups, we had to kind of get aligned in order to make that decision. Now, each one of these boxes had their own way of thinking, their own version of the truth, their own analysts, and so on. And it became really, really, really challenging. And each organization had its own perspective of the world. Now, if we are going to make better use of data, if we are going to make AI and maximize value from it, we've got to create more clarity and accountability around decisions. And this is very much in our power, and we can do this right now. And that's one of the really, really important takeaways in terms of, if we are going to unleash that power of analytics and data and AI, we've got to do this. Next slide, please. Slide before, please. Yeah, thank you. So the other thing, the last point I want to kind of share here in terms of how we can really accelerate the whole data to decision to action, it might sound a little bit controversial, but we have to make that shift from analysts, decision-making with the analysts, analysis with the analysts, to the boardroom. As AI evolves, analytics will become commoditized. A great example by Chen. I can ask it questions. I have confidence in it. It will tell me what I need to know in terms of how many people left last month, why did they leave, and so on. But the real value lies in the questions leaders ask and the quality of the decisions they make. Again, going back to David's point about what makes a good, thriving organization versus an organization which is struggling. We do need that paradigm shift, and that requires us moving away from thinking about staff numbers to staff needs. It involves us thinking about costs to what are the outcomes of delivering. It involves us to shift from the view of activity to what value we're adding to our population. Unfortunately, a lot of the current investment in healthcare focuses on the technical solutions, some of those which Chen was talking about earlier on. This is, of course, important, but without upskilling decision makers, we risk of missing a huge opportunity here. And we know that boards we work with, when they see better data insights, unblock issues, improve conversations, drive engagement, when they have that confidence, they really do make a difference. And that's really, really critical. So we do need to invest in boardroom capability in using data to drive better decision making. Now, all of this sounds quite basic. It is. Execution is bloody hard, right? And for that reason, next slide, please. What we're trying to do at Strauss is create a movement of like-minded people, pulling them together. And we've created this framework, what we call the Decision Intelligence Framework for Healthcare, and is designed to help boardrooms, board members, to start using latest technologies around AI, but the basic stuff around decision intelligence to really identify what the real key issues are and solve those real problems, not only within the buildings, but within the systems as well. And this includes a combination of tools and techniques. So if you're interested in joining this movement, please do reach out. And I kind of just wanted, and this is all based upon the learnings we've kind of accumulated over the last 8 years based upon real results. We'll be sharing more information of this over the next few weeks. But just to close, one of the questions when we were setting this webinar was, what can AI do to transform healthcare? It will. It will. I think the real question is, how are we going to use it to create smarter, fairer, and healthier communities? I think that's the key question we've got to ask. Thank you.
Thank you, Naeem. One question before we open up more broadly for questions to all of the speakers. As you've described, you've worked with many boards. It feels to me and lots of my peers that we could be doing more in using AI and data in the way that you describe. What do you think is going to make the difference in terms of the embracing and adoption of new ways of thinking?
It's a great question, David, and I think there's a few things. I think first there's an acknowledgement. So typical response I get is, oh yeah, we've got lots of dashboards, lots of reports. We don't need to do more work on that. So I think there's an acknowledgement that we could do more. Secondly, I think is headroom. And I remember when James and I were working in the previous organization, it was the leaders saying, we are going to create some headroom to step back and think about what we can do differently here. I think that's the second thing. I think the third thing is mixing it up. We have to break down the silos. I mean, we're seeing this right now in terms of the financial pressures on the NHS. The conversations are around, cost reduction, finance leaders taking that on board. But actually, it's not about cost reduction. It's about how can we create more value with the limited resources we have. It's a chief medical officer saying, look, we're doing something in this particular way. We're going to do it differently going forward. And that requires a different type of workforce and different type of makeup. It requires different models of care, different conversations with primary care and so on. Until that happens, I think we become stuck, and that conversation needs to be led by the leaders, the boardroom. They have to have the acknowledgement saying we need to think differently. And I think fourthly is we need to think different about board development, David. Currently it's a very theoretical exercise, and one example, working with James is actually becomes practical. When we think about forget the theory. We've got patients coming in, we've got staff with certain challenges and issues. What are we going to do to solve that problem? And we saw a little bit of that when COVID happened. You know, when problem was there in front of us, we got together, we took a multidisciplinary approach, interdisciplinary approach to make that happen. So I think these are the few ingredients we need to have in place, David. But I think the final thing I would say is the center needs to relax itself. It needs to allow organizations within their communities to start exercising judgment and actually getting on with the things they need to. Because I think, you know, one CEO I was speaking to the other day was saying he's spending 90% of his time, you know, dealing with the center rather than actually getting on with running the organization. I think that headroom is really, really important.
Thank you, Naeem. Yeah, I agree. I agree completely. It all feels a bit out of balance at the moment. Right.